Time to play Guess the Diagnosis after eating one hot wing. Drew, are you ready?
I'm ready. I hear ghost pepper is what I'm going up against.
Ghost pepper. So I need you to take one big bite of that first. Geoff, are you ready?
I'm kinda.
All right, start eating that wing.
Okay.
And then here come the questions. Number 1. A 65-year-old patient presents with sudden onset of severe chest pain along with tearing back pain. What is the likely diagnosis?
We're dissecting. Aortic dissection.
Aortic dissection.
Aortic aneurysm, fine. I mean, I question. It's a dissection, not an aneurysm.
There you go.
Whatever.
A 35-year-old patient presents with 2 weeks of productive cough, fever, fatigue, joint pain. He recently ran a marathon outside of Phoenix. A chest x-ray shows infiltrate with hilar adenopathy. What could be the diagnosis?
I'm dying over here. So this is something that they picked up in Phoenix. So this is like a fungal infection here, like San Joaquin's Valley, whatever, something pneumonia.
Oh, is this valley fever?
Oh,
Coccidiomycosis, that's what I was getting at. Yeah,
there we go. How's it going over there? You doing good?
It's hot.
A 48-year-old construction patient presents after being hit by a falling beam at work. He initially lost consciousness, but is in the ER now, coherent and talking. What might be the diagnosis?
He's an intracranial bleed.
Oh, does he have a concussion? Oh, okay. I'm not doing great, but this is delicious.
Is that hot?
It's getting there.
This is the epidural hematoma.
Oh, there you go. I'm gonna keep going. A 14-year-old boy with a new onset limp and pain in his groin. What could be the diagnosis?
Growing pains. Growing pains.
Is this a skiffy?
Ooh, a skiffy. Yes,
skiffy.
absolutely. I agree with that one.
Should you take another bite, Drew?
Oh, you need, okay. Okay, it's heating up in here.
A 45-year-old woman has difficulty swallowing, heartburn, and a sensation of food getting stuck in her throat. What could be the diagnosis?
So there could be food getting stuck in her throat. This could be an esophageal sphincter or stricture, but she could also be having an MI.
Is this a Shotsky's ring? Oh, I'm not doing great here.
Come on, Geoff.
GERD.
A little GERD. You might get some GERD later.
I have GERD right now. It's
a 60-year-old patient presents with joint pain, morning stiffness, and swan neck deformities of their hands on plain film. What
rheumatoid arthritis. We just covered this in EMDR today. Yeah.
Nailing it. Come on, Geoff. A 60-year-old patient presents with joint pain, morning stiffness, and swan neck deformities of their hands on plain film. What's the diagnosis?
Got rheumatoid arthritis.
All right. A 30-year-old patient presents with cramping, abdominal pain, and diarrhea after a recent camping trip. Guess the diagnosis.
Giardia.
Oh, she was drinking that beaver water. It's the Giardia.
Ooh, dude, you're just nailing these. I don't think it's hot enough.
Not hot enough. Another one.
A 65-year-old man has progressive difficulty walking, tremors, muscle rigidity. What might be the diagnosis?
Oh man, muscle rigidity. I mean, is this like a one of our movement disorders, right? Something. Is this like Parkinson's?
They're ataxic here. They have Parkinson's.
Ooh, damn.
Let me get a bite in here.
Great at this. What's the spice level? What are you working with?
I'm not having fun.
Big bite. 20-year-old college football player comes in with fatigue, severe muscle pain, cola-colored urine after the first 2 strength sessions of string practice.
He's got rhabdo.
I prefer it being tea-colored urine, but this is rhabdomyolysis.
Boom. A 14-year-old male has severe pain and swelling in his left scrotum, fever, nausea, and vomiting. What is the possible diagnosis?
Oh, there's a torsion until proven otherwise.
I mean, does he have torsion?
Testicular torsion,
Yeah.
the worst.
Yeah.
A 30-year-old woman presents with a butterfly-shaped rash on her face, fatigue, and joint pain. What could be the diagnosis?
Lupus.
Is this lupus?
Lupus.
Yes.
There you go. How's it feeling, man? Hot?
It's toasty. It's toasty.
A 12-year-old child has a high fever, sore throat, and drooling. Their voice is muffled. On exam, their uvula is deviated off the midline. This is also what killed George Washington.
I have no idea what killed George Washington, but this is a retropharyngeal abscess.
I don't know if this is what killed George Washington. Is this a peritonsillar abscess?
Boom.
Peritonsillar abscess, sure.
Bingo.
I didn't know that George Washington died from that.
Right? A 40-year-old woman comes with root pain as well as back and shoulder pain. She has a fever along with nausea and vomiting.
All right, so right upper quadrant pain. She has cholecystitis, ascending cholangitis, something with the gallbladder.
Ooh, is this cholangitis? Cholecystitis. Oh, all right.
50-year-old patient reports seeing floaters, flashes of light. They also report there's a shadow-like appearance in their vision.
Retinal hemorrhage or detachment.
Is this a shadow-like appearance of vision? Is this a retinal detachment?
Dude.
I'm having floaters too, but I don't think it's because my retinal's
A
detaching.
50-year-old comes in with red, hot, angry-looking big toe. They spent the weekend tailgating.
He's got the gout.
Got that gout.
The gout.
He's got the gout.
The gout. A 35-year-old construction worker comes in after a fall off a scaffold. He landed on both feet, complains of foot and back pain. What's going on?
There very well might be an acute fracture of the lower spine, but he also has a calcaneal fracture, heel fracture.
He's got ankle fracture and he's got vertebral fractures.
Ooh.
Look at me, look at me. You can't trick this.
A 24-year-old comes in after an MVC. They complain right wrist pain. Clinched first view radiograph shows a Terry Thompson sign.
Terry Thompson sign, so there's a fracture in the middle of the hand. It's spaced. It's between the second and third digit. Yeah, scapholunate dislocation. Great. Okay, cool.
Go.
This is that, I know exactly what this is. This is that, radio, now, what is it? Scapholunate, oh.
A 57-year-old shipbuilder comes in with progressive shortness of breath and cough, pleural plaques seen on that stick. So, what?
Asbestiosis mesothelioma.
Oh, he's feeling it. He's feeling the heat.
Is this mesothelioma? Asbestos, okay.
Dude, you did great.
Cheers.
Ugh.
How you feeling?
I'm burning, but I want another one.
Great job, man.